All right, welcome to another wonderful episode of Vaginas and Vertebrae Season 2. That's still really weird to say Season 2 because I don't even know how you dictate seasons in a podcast. But anyways, this is Dr. Kaylee.
Dr. Madeline.
And we have a really, really special guest with us today, and she's going to introduce herself and give you her full name. I call her Zool, and she's this lovely, beautiful woman here with us, and I'm so excited to interview her for this podcast because she is one of those people that, and Madeline, you can kind of confirm this too, one of the people that you meet that seems to just know all the answers.
Yeah, her energy is just so great, and she's like so loving and caring. I love it so much.
Yes, and you
so glad to bring it to the podcast world.
Yeah, and you get in a room with her, and her energy is really contagious, and so I can't not smile when I'm around her. So if you can't hear it in my voice, I'm really excited to be here. One of my favorite midwives in the area, one of my favorite people to talk to about anything birth. And so go ahead and introduce yourself, Zool. Tell us a little bit about who you are, what you do, what's a little bit about your story.
Hi, everyone. Oh, my goodness. Thank you for that introduction. I feel special. My name is Sulhail, and my family and friends and clients call me Zool, Z-U-L, and I am from Puerto Rico, and I live now in St. Petersburg in Florida, which I love being here, and I'm a home birth midwife.
Perfect. And where were you before St. Petersburg? You were in LA, right?
Yes. So I was in Puerto Rico until I was 27 years old. And then I moved to Los Angeles and lived there for around 12 years, which was an amazing experience. Like my journey, my formation years as a holistic provider, it happened there. I also live with a traditional midwife in Mexico for 6 months. I move in with her, learn her practices, the tradition. I live in her home, went to births with her, learn about plants, and it was a life-changing experience.
That's so cool. Have you noticed, out of the different areas that you've lived, is there any major differences that you want to share with us, especially in the birth realm?
Yeah, I will say yes. I think LA is a little bit, I will say, more, you see more progress. Like a lot of people, I think, tend to use, and maybe the word will be value, a little bit more holistic care. And when I say value, is not only understand how powerful it is as a form of wellness, of staying healthy, of prevention, and also maybe monetary value, paying for those services. I would say overall for everyone, midwives, chiropractors, acupuncture, everything. I think here in Florida, I think we are doing a lot of education. A lot of people, I think, want to support us, but never heard of the information or what we do. So I think that will be the major difference.
Yeah. And Zool, you and I have talked about this too, because when I first met you, you said, oh yeah, in LA, I had this pelvic PT I referred to, and I had a chiropractor and an acupuncturist. And I do feel, we talk about this a lot on the podcast, I personally feel that even though we have access to all of that here in Tampa Bay, I feel it's a lot harder to get people like ourselves that have all of those connections and that have all of the people that we're referring to, because it's almost like this dissociation of, some places it seems like it's a really great, LA specifically, because I read a lot of research and things that is done there, but it's really interesting to see how the village that we talk about all the time, you need a village to support you through pregnancy and postpartum for prevention, but also for care and management. I feel like it's so much more, it's easily accessible there. Whereas here, I still feel like I'm having the conversation with people on, why do I need a pelvic PT? Why do I need a chiropractor? Why do I need acupuncture? Which I'm not saying is a bad thing, but I think that ultimately it's really nice to have you here, because I feel that you do such a good job with educating people on not just referring, but also the differences between hospital birth and home birth and going into that realm. And so I don't know if you have anything else that you want to touch on there about the difference in accessibility, or if there's anything else to say.
Yeah, Kylie, I agree with you. I think access go hand in hand with knowing the information. And to know the information, I believe it needs to start with us collaborating as practitioners, because as a midwife, even though that I work right directly with the body of my clients, I'm not a pelvic floor therapist. So for me, how I see it is that if I recommend you as a pelvic floor therapist, I'm doing my job. It's helping me with my job. I feel like during pregnancy, I'm not a chiropractor. So right away, I'm going to have, and it's going to happen with every client, that is going to come like, oh, I have a pain here. And they think they have to stay that way for 9 months. And it's like, no, how about if you see a chiropractor to help you with that during your whole pregnancy? So if it start with us, right? And then that's when they go like, oh, wait a minute, I'm here because my midwife refer, she said that this will help. And that's something that, even though that I'm the primary care provider, I can take away that discomfort, or maybe provide the education how you guys can, because that is your specialty. So yeah, it's not only access, but it's knowing how I can access to
Yeah,
that provider or that particular help. And we need to know each other in order to refer each other. And I
absolutely.
don't think that happened here often. I think it's happening because we're here today, right? And that's how we all met. But it's taking a little bit. I think in LA it happened more.
Yeah, yeah. And I love that we talk about that though, because I have clients all the time that'll come in and I tell them the same exact thing. Like, well, I don't do what a chiropractor does. I don't do what the midwife does, because I think it's this, because pelvic PT in itself, like there's a lot of education to be done there, because people are like, well, what the heck do you do in there? And why are you in there so long? Well, there's a lot that we can go into in that realm, but I 100% agree with you. And that's why I think like we really started this podcast for that as a purpose, is to really just get these resources out there so people know, because I'll tell you too, a lot of clients still don't know what a midwife does that I work with, and they still don't understand why they would choose a midwife versus an OB, or like the options that they have. And we're going to talk about that in this podcast. And I'm excited about that, because I love what you said about it starts with us, because it's so true. And I think that that's a really powerful thing to consider. And if you're comfortable too, Zool, I would love if you would share with us a little bit about your birth experience and kind of what drew you to midwifery. Did I say that right? Midwifery?
Yeah. Yeah,
Okay.
yeah.
I was like, is it midwifery or midwifery? Because that's where I'm for, like Tennessee, it's midwifery.
Yeah, I feel like, I don't know. I'm like, I think American people just love to say it their favorite way, and I don't know if it's their favorite way or the right way. I just say midwifery, but English is not my first language, so that's that. Yeah, I do, and thank you for asking, Kylie. So I have two completely different birth experiences. I came into, I will say, the midwifery world opened to me after my first birth, because I had my child in Puerto Rico. um, uh, I ended up having a cesarean section, which that's something that I want to clarify, like midwives and holistic providers, we're not against, like I'm not against hospitals, I'm not against OBs. I think it's amazing that we have OBs, hospitals, to be able to do a surgery when it's needed. In my case, it wasn't really needed, and my experience was very traumatic. My doctor wanted to go home, and I was there for hours. And after putting me in very uncomfortable situations, giving me medications that I didn't need it, he ended up pushing me and, in a way, bullying me to a cesarean 4 hours later. So that was something that I couldn't talk about with many people, especially being in a place where that is the norm, because so many people have had that dysfunctional experience, right? That traumatic experience. Is almost like when you mention it, instead of, I guess the way of being compassionate is sharing their horror story, saying like, oh, wait a minute, that wasn't that bad, wait until you hear my story, or my friend's story, or my neighbor's story. And then once I moved to Los Angeles, I was able to hear, wait, have you ever considered midwifery or heard about this, which I never did. So I started doing my research and fell in love with the whole birth world, like completely. Not only with birth world, that's how I find out chiropractor care, that I start with that first, and then continue to acupuncture. And then through learning about midwifery, I thought for myself, I ended up wanting to become a provider. And then 13 years later was able to have my VBAC. One of my mentors were my midwife, and it was beautiful and it was healing, not in the ways and for the reasons that I thought it was going to be. It was the whole journey, right? Like, it wasn't healing because I was able to have a VBAC. It was because I was able to, one, at that point, I was already a midwife. So I was able to go through so many different experiences with my clients that by the time that I had my experience, it was life changing for me as a mom, as a woman, and as a provider. And it was a home birth. Yeah.
But Dr. Gailey and I are like, wow, that is so great. Thank you for sharing that.
You're welcome. You're welcome.
Mm-hmm. Can you talk to us a little bit about what your opinion is on home birth?
So thank you for asking that. So this is what I believe, this is what I do, right? So I do believe in home birth. What I don't believe or advocate is that home birth is for everyone. So, and that's an information that I want to pass around. I think, and I think that, I mean, I can't speak for everyone, but I do think the majority of midwives feel that way. I think that we believe in the right to choose the location that is best for the pregnant person and their family, right? Whether that is the hospital, whether that is a birth center, or whether that is at home, right? And I think the part that affect this choice is that unfortunately the majority of insurance do not cover us. So if you don't have the access to make that choice, then it's not really, sometimes a real choice, because we're not covered by insurance. A lot of people that seek our services are self-pay, even though that is not the amount of money that you will pay to an OBGYN. But I think a lot of people don't know this until they talk to us. And I think that that can be a little bit of a barrier. So I encourage everyone, if you want to have a home birth, please don't stop or don't just assume that you cannot afford it. Please call your midwife or call a birth center. So that's what I believe. Now, the other part to this is that home birth is for low risk moms or persons, however people identify themselves, but it's low risk. So that means that if you have, let's say, if you have hypertension, or if you have already a chronic condition like diabetes, you won't be able to have a home birth. But then again, I invite everyone to just start having a consult with a midwife. Don't assume that you're high risk. Don't assume that you cannot have a home birth. Just please sit with a provider, with a midwife, and talk about your health history to see if you're a good candidate for a home birth. And finally, Madeline, we've seen a rise in home birth due to COVID-19. I also want to say that fear should not be a factor in having a home birth. When people call me and they say, well, I want to have a home birth because I don't want to go to a hospital because I'm scared, that's really not a factor. You should want to have to make that choice for your own reasons, not because you're scared.
Yeah. That's really powerful that you touched on all of those things, because I think, 2020 obviously has brought this whole new slew of problems and things to consider when it comes to pregnancy and giving birth. And I find that a lot in my office with clients they feel like they're almost being pressured into having to have a home birth versus being able to choose. And that's something that I think we can all agree on, is it 100% is still a choice. And you need to make sure that you consider that. But I love that you say, like, to call the provider, call the midwife, have a conversation and ask first. Because Madeline and I both say the same thing about finding a chiropractor, finding a pelvic PT. Because let's face it, and Zul, you probably agree with this, like we're not for everyone. Not every client is going to vibe well with us. I have a lot of freaking energy and I'm not for everyone, and I understand that. So knowing that you can call and have a conversation first, ask those questions. I'm fearful of this. What if this happens? This is my history, and see what we can do to kind of help you find and guide you to those resources that you deserve. Because I think that that's really important. So thank you for touching on all of that, because that's so important. And if anybody's interested too, we have a podcast, because you brought up the insurance information. We do have a podcast about insurance versus like private pay in season 1 of Vaginas and Vertebrae. So be sure you go back and listen to that, because it is important to note that your insurance dictates a lot and the reasons why they dictate a lot of that information. But really, if you consider like the whole gist of things, you really need to choose the provider and the care team that is there for you. And that's really important, with or without insurance. And so I know that that's a big discussion, but have that discussion with your provider as well. It's important. But yeah, thank you for touching on all of that. And now I want to kind of like dive into, because you and I have discussed this, and I'm going to be 100% honest, that I have a lot of lack of knowledge around this, what I'm about to say. I don't know much about placenta encapsulation, and I would love for you to kind of like take the ropes. Tell us what it is, why you do it, what are the benefits? Because I get a lot of questions about it, and I'm like, I don't know. It's like that new song out there that's just like, I don't know, and like everything you don't know. Like, it's really important though, because I want to learn, but I also want to have this as a resource for clients, because I think that it is beneficial, but I don't know why. So I would love to hear like your thoughts on like what it is, how it's done, and what are the benefits of it.
I love it. Thank you for asking. So placenta. I love placentas, and I know that that can be, you know, like a word that people sometimes go like, ew, why placentas? So I will describe it in an easy way. Placenta, in a way, is the first companion of the baby. In other cultures, they say like is a culture in a tribe in Africa that describe the placenta as the sibling, as the twin of the baby. And it's the first home. The placenta is an organ that is amazing, because right now, none of us have it, right? So how cool is that? It's an organ that is specific form during pregnancy, is where it has the lifeline of the baby. It is full of nutrients, oxygen, blood, and all that amazing, again, like the base, the life of that baby. So that placenta is created with the baby, and it will stop existing once the baby is out into the world, because first the baby is going to be born, but the birth that's not the end of a birth. The end of a birth is once that placenta is out. A lot of people explain it like, if you have had animals, you will see that a dog, a cow, they will consume their placenta after they have the baby. So it is the nutrients that that placenta have, and it has a list of hormones that I'm not going to mention now, because I want that people keep the important part, and is that it has amazing nutrients, like for example, iron. When you have, during your pregnancy, your iron is going to lower. You hear a lot of people saying, oh, I'm anemic, or that can affect your oxygen, that can affect your labor, because you're going to have a blood loss during labor that is normal and is expected, but it can affect you postpartum, right? So now, instead of buying a supplement or saying, oh, the hospital is going to give me iron, like being able to put back your own hormones in your body to support your wellness, first of all, is amazing. Now, that's just one of the benefits. The one that I love and believe, and why I'm doing this, is because I think that a lot of us have heard the term baby blues, or then later on, which is completely different, postpartum depression. So when someone has a baby, it's going to be a drop of hormonal change, or a drop of hormones in the first 72 hours. That's why if any of us have worked with postpartum, or had a sibling or a family member that you go and visit this person when they have a baby, they will look at you and be like, and you're like, oh, congratulations, are you happy? And they will look at you and say, I am so happy. Oh my God, I'm so happy. Like suddenly they're crying, and you're like, oh, I kind of thought you're happy. you're going to see this mood change, right? And it's due of that hormonal change. So one of the amazing benefits of the placenta is putting back those hormones in your body to make that process more balanced, therefore prevent, not eliminate, but prevent or make that, maybe that part of the baby blues more, I will say more balance. That's the best word that I can have, more balance. And in many, many cases, and I've been doing this for 10 years, prevent postpartum depression. I have had families, I always ask, I will check up with them how they feel, and I specifically, and again, I'm not saying like if you have postpartum depression and if you take medication, this is not a substitute for your medication or for a person to just consume their placenta and do not pay attention to those symptoms. But I can say that I have a lot of clients that have consumed their placenta and that their postpartum experience is completely different that what they had before when they have depression. Something that I see, I've had a lot of people that maybe have postpartum depression for a year and they didn't know until it was gone, because it's something mental, postpartum mental health, something that I'm very passionate about, but it's not talked often enough. And I do have to say that I have people that once they get better, they're like, wow, when I look back, I realized that the first year of my baby's life, I was depressed. And then when they have their placenta, it's not that they don't have the symptoms, but they're way shorter, maybe last a month, 2 months. And they're like, wow, Zul, thank you so much. These just have made a difference in me. So even though that I'm a midwife, I haven't stopped doing placenta encapsulation, and I believe it. I actually have the best compliment of an OBGYN at the hospital that say, wow, I've never heard of this. And she actually wrote me an email and she said, but please keep doing this, because one of my clients raved about, I didn't have to recommend the medication that we did with her other prior baby. And I'm like, why? What are you doing? Like, do you just have it? Like, what exactly did you do? And she mentioned you. So she's like, please keep doing this. Mm-hmm.
I love that. And it's something too, like I recommend, but again, I have to admit, like, I didn't really know why I would recommend it. It was just clients would come in and they were like, I feel so much better with this. I know that it helped. And I'm like, cool, go do that. And then I'm like, wait, I should probably know why. But I do have a question about this, mainly because I know it's a question that I get asked about. And it's also a Google search question. I only know that because I searched it myself. But when it comes to like encapsulating your placenta, like how does that work? So you take the placenta after the female gives birth.
Yes.
How do you prepare that? Like, how does someone consume that? Are we eating it like just how it is? Are you putting it into little pill form things? Is it a liquid? Like, what does that look like?
Great question. So first of all, I do want to say, if anyone is interested in this right now, you can Google it and look for a placenta specialist. Like, it is a profession. A lot of doulas does it, a lot of do it, a lot of midwives or people, they're just people that only do that as a profession, right? So I will say, find a professional before you do it. And yes, and how it works is that usually you will find your placenta encapsulator while you're pregnant. That person is going to give you instructions to maybe bring a cooler, or your placenta encapsulator is going to bring a cooler. If you're having the baby at the hospital or even at home or with a birth center, is something that you have to relay the information to your provider. Arrive there and say, hey, I will want to keep my placenta. And that is a right that everyone has, but you do have to convey that information. Why? Because we do not want this placenta mixed with anything. So you have your baby, you're going to be in contact with the person that is going to do your placenta, and that person is going to go to whatever setting location you have your baby, pick up the placenta, take it to their home, or their practitioners that do it at the client's home. They will wash it with water, they will clean it, they will cut it, and then these pieces of placenta that are used are going to be put in a dehydrator for around 15 to 17 hours. So this is going to be dehydrated, then it's going to be grounded, and then it's going to be put in capsules. And that's the only thing that you should have in your capsules. And yes, my recommendation is to consume your own personal placenta, not your friends and not a stranger. So you do not want to buy placenta pills from anyone. So that there are two methods. Is the traditional, is what they call the TMC, that is traditional Chinese medicine method, and then the raw method. With the traditional Chinese medicine method, the placenta is steamed to bring heat in a symbolic way, to bring heat to that placenta, and then to put that heat back in your body, because it is believed that once you have a baby, your uterus stay cold energy-wise. So then there are people that want to follow that, that they want to follow that and then say, okay, yeah, I would like that. So it's been like steamed with warming herbs like pepper, like ginger. So you are being given I will say, like, once it's ready, usually take like 48 hours. The professional that did your placenta will deliver it to your home, and you will ingest your placenta, usually like 3 capsules a day for around a month to 6 weeks. You can also do placenta smoothie, especially if you have low iron or if you had a big loss in your birth. You can take a chunk of your placenta, or the person that is doing that for you, and mix it with, it can be juice, it can be fruits, it can be even like herbs like maca, spirulina, and then you consume your placenta. There are people that cook it, so you don't need to have a professional doing your placenta in order to ingest your own placenta. There are recipes that you can find online. You can always consult with someone, but yeah, but those are like the different ways that you can do it.
That's really cool. I also wonder too, like, because I see a lot of clients that come in with like hormone imbalances, and I can just tell, and I wonder, like, research wise or evidence wise, like how much better our postpartum recovery can be if this was just the normal. You know what I mean? Like if this was just something that you got after you gave birth and it was normal. I would love to see that though. I think that that's really incredible. And I am all about like the holistic way of doing things. And again, I see a lot of like the baby blues, a lot of postpartum depression that I refer out for. We see a lot of the lack of hormones in the sense of not wanting to have sex. I'd be really curious to see all of that. I think that's awesome though. That's a big deal. That's amazing.
Thank you. Thank you. Thank you. Thank you. Madeline, what do you see in your office? Have you had clients that have mentioned to you placenta, or that you have had any feedback?
Not that I'm aware of. Not too many women have talked to me about like necessarily consuming it or not. So I'm not sure, like across the board. I'll have to start asking a little bit more when that comes up for like their postpartum plan, what they plan on doing with it, and see.
Nice. I love it.
Yeah, I get asked it a lot, but I think it's a lot to do with the fact that I ask all the personal questions too. Like, what's going on with your vagina?
Yeah, you
Let's
do
talk about this.
You do, Kylie. Yes, yes. Now that I'm your client, yes, which I love it. Now I know more about what you do.
It's so amazing. Yeah, I love it. I love getting the questions though, because it's just like you said before, like it is my duty to be able to have resources for clients. And I always refer them to you to reach out to you to ask those questions. And I do hope that they are reaching out, because it's personally, like in the area, I haven't had many conversations with too many doulas or midwives. I know they're everywhere, but the ones that have presented it to me as something that they do is you. And so it's nice because I get the clients that are coming in like, oh my gosh, Zul's the one that did my placenta. And I'm like, yes, that's great. I'm just going to keep sending people to her because I know she's good. People are happy. That's awesome though. Yeah. Thank you so much for explaining that whole process and even the dosing schedule. Because I think it's another one of those things that people, for some reason, society makes it sound gross, and it fascinates me. It's the same as like menstrual blood. People are like, oh my goodness, it's disgusting. And I'm like, It's in our body, first of all, and it carried your baby, second of all. Third of all, it's totally healthy. So I love that you explained like that whole process, and it's better for us than the majority of things that we do, it sounds like. So that's awesome.
Absolutely.
I'm not gonna lie, I probably have a hard time in my brain eating it.
I love it.
But I would take a pill, like of it, dehydrate it. That's what I get behind. Eating it,
I was thinking
a little bit of a stretch.
Yeah, do you like take it out and then you like fry it in a frying pan and then you eat it? Like, is that what people do? And that's why when I learned about this, because when I started doing like women's health training, I was like, you do what with it? Like, why would you just eat it with a fork like that? But then I learned about encapsulation and I was like, I'm down for some of that. That's awesome though. Yeah, awesome. Well, Zul, how can people find you? Like, what's the best way for people to find you? What happens with our podcast is people love to follow people on social media from here. They love to see what you're about, what you're doing. So feel free to share website, resources, whatever you have. Definitely Instagram. For some reason, our followers love Insta. So definitely share how to find you, because I'm hoping that people reach out and start asking questions, because this is not something that we need to be afraid having a conversation about, whether it's a home birth, whether it is about a midwife, whether it's about finding the right midwife, whether it's about placentas. Please feel free. And you also do, correct me if I'm wrong, but you do steaming as well, correct?
I do. So I also do vaginal steaming care. I do it for everyone, whether you're pregnant or no, and postpartum.
Perfect.
So yeah, if anyone would like to find me, to talk to me, to follow my page, I'm in Instagram as UMA Midwifery, Uma Midwifery, or Midwife Zul. I have a Facebook page, and I also have a website called Uma Midwifery, and I will anyone, from anyone and everyone.
Yay. I love it. And we'll make sure that we have all of that in the show notes as well, just so people can click on it and just go straight to it. Because she is definitely someone that you want to follow, not just for everything that she shares education-wise, but for her heart. And you can tell, like, on her social media profiles, how much Zul gives to her clients and how much love she has for each person. And personally, I think it's a lot more about your birth story, just getting the information out there and helping people find that education. And I think that that's a powerful thing that we need more of. And so I'm super grateful that you came on the podcast. Thank you so much for being here.
Thank you to both of you. Thank you, Mother. Thank you.
It's been great. And guys, make sure that you check out the show notes. Make sure that you go and follow her, read all her things, be her friend, say hello, and she will be super excited to teach you what she knows. And until next time, this was Vaginas and Vertebrae.
Bye.